Hi, my name is Scott Simon. I'm a neurosurgeon with orthopedic and neurosurgery specialist here in Greenwich. Thank you very much for having me talk today. My topic is on concussions in our youth. Concussions are a significant topic in this community. Many of you have children playing sports and playing them at a very high level. But there's a lot of information and, frankly, misinformation about this very significant topic. So first of all, concussions are very common. And when we look at the different sports involved, we see that football is often at the forefront. But by far, football is not the only sport in which concussions are reported. And it's not just men. If you see here on this slide talking about the frequency and distribution of the rates of concussions for NCAA games and practices, women have a significant proportion of concussions that are reported. And if you look at the women and compare them to their male counterparts, women actually report concussions more frequently and actually are suffering concussions more often than their male counterparts. What is a concussion? And a concussion really now is determined to be a mild traumatic brain injury. We used to grade concussions. We no longer do that. A concussion is a concussion. It's like being pregnant. If you have a concussion, that's all you need to know. We don't talk about mild concussions. We don't talk about severe concussions. Concussions are a mild traumatic brain injury that is a functional injury that reverses spontaneously. It's like setting or pushing the button on a computer. When you push the reset button on a computer, the computer powers down and it needs time to repower up. During that time, as the computer's powering back up, you cannot use the computer. Same thing in the brain. But there's not a functional problem that's ongoing in the computer, and there's nothing that we can detect that's going on in the brain that's a structural problem that's going to last. Concussions are, again, reversible. There's nothing to be seen on a CAT scan or an MRI. When we do a CAT scan or an MRI, we're looking for other problems. We're not looking for concussion. Conversely, you cannot be diagnosed with a concussion through imaging. So if the physician in the ER comes back and says the CAT scan is normal, you don't have concussion, that's a misstatement. People often say, well, I didn't get knocked out, so I don't have a concussion. Really, a concussion is defined as any derangement in sensorium, meaning that any alteration in your mental status. Only 10% of concussions have a knockout episode associated with it. But the symptoms from concussions can be long-lasting. All right, let's go through some neuroanatomy. So I love this slide because it really is very clear what's in the skull. Well, you have your brain, you have the cerebrospinal fluid or brain fluid that circulates around the brain, and you also have blood that circulates in the brain itself. Those are the three things in the brain. But you can see here, the brain isn't attached to the skull. So just like an egg, if you shake someone's head, the brain gets shaken. Just like you shake an egg to your ear, you're going to hear something shaking around. The yolk doesn't move in concert with the shell. So the pathophysiology of concussion is thought to be a shaking injury, where the skull shakes and the brain shakes inside the skull, and it's that acceleration, deacceleration that causes the nerves to sort of go to sleep. You have an indiscriminate release of neurotransmitters during this injury, and everything sort of gets depolarized, and you get a hypermetabolic state. The brain starts going to overdrive. And you have what's called derangement of autoregulation. Autoregulation is the ability of the brain to see a constant blood flow, meaning that when you get up in the morning, you don't pass out when you stand up. The brain is able to regulate the blood flow when you get up so that it sees more blood flow. Conversely, when you have an episode of anxiety or stress and you have your heart races and the blood flow goes up, the brain doesn't want to see too much blood flow, so it's able to autoregulate. When you have a concussion, that autoregulation can be impaired. And you have a decrease in cerebral blood flow during a concussion, and followed by a hypometabolic state. So all those things can lead to symptoms. So what are the physical features that we commonly see with concussion? Well, first off, we can see a loss of consciousness. As I said before, it doesn't have to be present to diagnose a concussion. Poor motor coordination. We always see those people sort of getting hit in the football field and sort of staggering back and being taken out of the game. Sometimes you can even have a convulsion where they actually have seizure-like symptoms on the playing field that is short-lived and does not have any poor prognosis in terms of the development of any types of epilepsy. And some of these patients can have slurred or incoherent speech right after the injury. And then what are the cognitive effects? Well, often you take these people off the sideline, you ask them some questions, and they sort of just stare at you, or they get a little agitated. They have some delayed responses in terms of questioning. They're very distractible, disoriented. They can have poor recollection of the event. I've heard many times of a child that I evaluate for concussion saying, did we win? And this was after he was put back in the game and played the rest of the game, and he had no recollection of anything after the time he got injured. Typical symptoms: headache, dizziness, vertigo, lack of awareness of your surroundings. Those are very typical early symptoms. But it's the late symptoms that are often very disturbing and frustrating, because you feel like you should be getting better. But these late symptoms can last days to even weeks, such as persistent low-grade headaches, lightheadedness, poor concentration or attention, memory dysfunction, easy fatigability, irritability, photophobia, phonophobia. Very commonly, these patients do not like to be in a crowded room with a lot of ambient noise, or being in the car during night with all the other headlights going into their visual field. Sleep disturbances are very common. And it's this post-concussive symptom that is very frustrating because it lingers. But the other post-concussive sequela can be even more scary. And the one we often talk about, but it is very, very rare, is this second impact syndrome. That is when the brain suffers a concussion, or the computer gets the reset button pressed, and before the computer powers up, or before the brain has a chance to recover from the concussion, another injury is laid on top of it. And in a very rare instance, this second impact syndrome can occur where you have malignant edema that occurs in the brain, and 50% of these people can actually die from this. So that is a very rare phenomenon, but it can happen, and that's one of the reasons we don't want our young athletes to go back into the field until they've fully recovered from their concussion. The other more common reason is if a second concussion on top of a recovering concussion can perpetuate this long history of, these long post-concussive symptoms. Post-concussive symptoms have this constellation that is very disabling, and again, may last weeks to months. Often older age or even female gender can be associated with a longer recovery period. In Connecticut, we've passed a law that basically states you cannot go back into the field and play after you've suffered a concussion until you're cleared by a medical professional. And this law was further strengthened just this past year, stating that concussions need to be identified. You need to limit the number of hours of contact sports that the patients are allowed to do in a week. And any athlete suspected of sustaining a concussion, again, has to have full written permission from a medical professional before returning to play. The main take-home here is, when in doubt, sit them out. I said that there's no way to diagnose a concussion based on imaging. A loss of consciousness is not necessary for concussion. If there's any suspicion that a concussion has taken place, you take the player out, sit them down, watch them, and see how he is or she is. Prevention. A lot of people talk about prevention. It's a hot topic. We've looked at things like education, changing the rules. We no longer condone spearing or leading with the head in football. We talk a lot about helmets and padding. I get a lot of questions from the coaches saying that, listen, I don't know why you guys are saying the concussions are more common now, because our padding and our helmets are better than ever. Well, number one, we're identifying concussions a lot more commonly, because again, we're not stratifying them in mild, moderate, or severe concussions. We're just saying concussions are concussions. We're also saying that you don't need to have a loss of consciousness. So we're identifying more people. But at the same time, there's not been good data to suggest that protective gear prevents concussions. And in fact, there's some data to suggest that preventative gear or protective gear actually will increase the risk-taking these athletes take. meaning that having them in full body armor will maybe give them more confidence to do that big dive into the scrum. Conversely, having a helmet doesn't protect the brain from that acceleration, deceleration force I talked about earlier. Again, if you shake the egg, you're going to hear the yolk rattling around. If you have a big helmet, doesn't matter. If you're shaking that helmet enough, the skull in it and the brain in the skull is going to shake, and that acceleration, deceleration is what causes the concussion, not direct contact to the brain. So I think helmets are important. They're important to protect the brain against direct contact. They do mitigate some forces. They definitely prevent skull fractures. I think they're an important piece of equipment, but they don't seem to prevent concussions. Similarly, mouth guards don't prevent concussions. This has been touted as a useful adjunct to try to prevent concussions. Mouth guards, the only thing they're good for is protecting the teeth. But again, helmets are not just for biking, they're not just for skiing. They should be worn during activities. I can't tell you how many head injuries I see during sledding season. And so I have my kids wear the helmet during the sledding. So I think helmets are important. They're important to try to protect the head, but they don't protect against concussion. So I'm not advocating not using a helmet. I'm a very pro-helmet kind of guy, but I am saying that you have to understand that don't be frustrated that your child was wearing a helmet in football but still got a concussion. What do you watch for after concussions occurred? Really any new progressive worsening headache, persistent or increased neck pain, any drowsiness, or if your son or daughter just doesn't look right, I think those are things that should prompt you to maybe seek medical attention earlier rather than later. Certainly any weakness, numbness, tingling, or unsteadiness, seizures, confusion, irritability, slurred speech, you take them to the emergency room. When do you image? Again, if a concussion is not diagnosed by CAT scan or MRI, why are we imaging? We want to make sure that nothing else is going on. Again, concussions, no imaging is really necessary to diagnose them, but imaging is important to make sure there's no traumatic brain injury that does need further intervention. So any prolonged loss of consciousness greater than 30 seconds, seizures, persistent confusion, persistent headache, nausea, vomiting, or extremity weakness, numbness, tingling, or pain, I think really prompts you to take the patient or your son or daughter to the emergency room and get a CAT scan at that time. What do you do about concussions? Everyone here is so proactive. It's great. You want to make sure you're doing everything you can for your child. Get them back on the field, get them safe, have them recover from this concussion. And unfortunately, there's not a lot to do except just let them recover. Let that computer reboot. A lot has been made of this cocoon therapy where you basically stick your kid in a room with the lights off, no TV, no game box, no Xbox, nothing to do, no reading. And that has not been shown to hasten the recovery from a concussion. A lot of the neurophysiologists in the field really don't subscribe to this notion of cocoon therapy. And a review of the treatment for concussions really found no conclusive evidence saying that sensory deprivation improves outcome from concussions. When do you return to school after concussion? Well, I think it's appropriate to keep the child home a day or two and then reintroduce them to school when they feel they're able to. And often I say just try half day first and pick them up early if they can't do that. It's just time. Every child gets back to their baseline at different speeds, and you have to just listen to your child. When you go back to school, they shouldn't go right back to full bore work. They should have some time off from homework, no time tests for at least a week, and then slowly reintroduce these more strenuous attention requiring activities. When do you return to play? Well, you have to make sure that they're successful in reintegrating back in school before you return them to sports. And you want to make sure that if they have any recurrence of symptoms through just going back to school, they're not ready for sports. Never return to play on the same day of injury. Again, you have to get clearance by a medical professional before they're allowed in this state to go back to their sport. And once they're cleared, follow a stepwise progression to return to play. So first, a little light aerobic exercise, followed by sport-specific exercise, followed by non-contact training drills, and so on and so forth. And during each step, if they have recurrence of symptoms, they go back to the previous step. Neurophysiological testing, the impact test and others like it are these online tests that the child does. They're really helpful if the child does them prior to injury, so they have a baseline to compare to. You can certainly do it for the first time after the injury and compare the child's results to the norms, but I think it's best to compare a child's pre-injury state to post-injury state. And what you do is you basically wait for that impact score to return to baseline. So it's an online test looking at reasoning and spatial recognition and timed and attention tasks that is scored, and you do that before an injury just as a baseline, and some schools do this, some schools don't, and then you see after the concussion that how much their score has dropped. And you can see sometimes that you have a significant decrease in the impact score, even if the child looks okay. Now, there's a lot of subjectivity to this test, meaning that, it depends on how the kid is feeling when they take the test for the first time when they're not injured. Kids don't like to sit in front of a computer, take a test, let alone at certain times of the day. If they're, rather be outside if it's nice outside. I think that there's some controversy about how helpful it is, but I think it's just an adjunct and it can't be used in isolation. You have to use it as another tool to help your judgment in terms of returning the patient to play. Contraindications to return to play. When do you not go back in the water? Well, I think that persistent headache, neck pain, arm or leg pain, numbness, tingling, weakness, dizziness, nausea, confusion. These are all symptoms that should tell you that the boy or girl is not ready to go back into play, and maybe some further diagnostic tests need to be done. So in conclusion, concussions are a form of mild traumatic brain injury. They're a functional injury that's completely reversible and spontaneously reversible and cannot be diagnosed through CT or MRI imaging. Only a minority of concussions involve a loss of consciousness, and diagnosis is really made upon symptoms and signs. When a concussion is suspected, you sit the child out. And a child should not go back to play until they have clearance from a medical professional. The best treatment for concussions is just rest and time. And when they do return to play, you want to return them in a stepwise fashion. Thank you very much.